Universal health care. The term is popping up more and more as the presidential election continues. It's important to remember the 2010 Affordable Care Act was based off health care laws here in the Bay State. Laws designed to cover more people and help offset the skyrocketing costs of health care. I went to Tufts Medical Center to find the effect of health care reform here in Massachusetts.
We have to change what we were doing, because if we go on the projected track for just status quo, we're in trouble. If we don't try to do something to intervene, then we're just being idiots.
Melissa Schuyler is the Director of Government Relations at Tufts Medical Center. She says the Bay State's health care law, created in 2006, has helped turn around the state's economy.
People who look at indicators for Massachusetts' success, not just about health care, but the health of the state and our economy and where we're going, say that we're in a much better position than most other states in the nation, and that in part healthcare reform may have had an impact on that.
In Massachusetts, health coverage has been expanded to 96% of the population. President Obama hopes for similar numbers under his law. The controversial way of doing that? An individual mandate.
We haven't really seen that much of a backlash from our citizens or from our employers about that mandate, but it is, from our view, an important component of actually making sure you can expand coverage that much.
Critics say both laws are essentially a government takeover of health care. Schuyler says that simply isn't true.
Millions and millions and millions of Americans participate in Medicare. That is government health care. So to the extent that people aren't comfortable with government and health care, they maybe ought to take a real hard look at what they're participating in already. And it works pretty well. Components of the Affordable Care Act are now making their way to the Supreme Court. Arguments are set to begin this week. Reporting in Boston, Trevor Savage, EIV News.